A team from the Singapore Red Cross is in Budapest, Hungary, to arrange for medical aid to victims of the Ukraine war using logistical corridors. Now, this is the first time the Singapore Red Cross is working in a war situation in Europe. Its previous aid missions have been mostly in Asia for victims of natural disasters. For more, Sahari Ani from the Singapore Red Cross joins us now from Hungary. Sahari, tell us more about the work that you're doing there in Hungary.
Actually, both of us, Karun and I, are now in Hungary for the past several days on a humanitarian mission to Ukraine neighboring countries that are hosting a majority of the refugees, that is Hungary, Lithuania, Slovakia, and Poland. Our goal is to oversee the humanitarian response supported by the people of Singapore to Singapore humanitarian efforts for the Ukrainian and to explore further opportunity to expand our operation. Since our arrival in Budapest, we have conducted several meetings with our partners, and we have visited a service operation location where our partners, the Hungarian Red Cross, have provided support to the transiting refugees in Budapest. And we were going to work closely with other humanitarian partners on the ground to identify and to support the other needs of the fast-growing refugee crisis.
Sahari, the needs of the refugees who've come into Hungary and those other countries that you mentioned, they are multiple, they're complex. Give us a sense of how you're getting that aid across to the people who need it the most.
1 million of people are in need of humanitarian assistance. Many of them have fled the countries, and others has been internally displaced. The Red Cross and the Red Crescent movement has a comprehensive presence and a network of national societies, either in Ukraine or the neighboring countries, and they are able to mobilize and scale up the necessary resources. With these resources, thus far, we have delivered almost 1,200 metric tons of aids, half of which has been delivered to the Red Cross, Ukrainian Red Cross for distribution. These aid are delivered either by line through trucks or by air through airplanes, reaching more than 1 million people, and further additional aids are in the pipeline. Our colleague is also working in close contact with the Ukrainian living in Singapore, as well as Singaporean living in and around Ukraine, to facilitate our work on the ground. We need many helping hands, and we are working closely with our Red Cross movement and humanitarian partners on the ground.
So a sizable amount of aid getting through to the people who need it. But what are some of the most urgent needs or supplies required that you've seen, Sahari?
The scale of the people movement is massive and is still very fluid, as it is influenced by the situation in Ukraine. The demographic of the displaced person, the children, the older person, the people with special needs, the impact, the physical and the psychological impact, the needs, the short term and the longer term. We also need to keep in mind that the Ukraine and the neighboring country are recovering from impact of COVID-19. These are intertwined factors that we need to consider as we try to comprehend and understand the challenges and needs. Of course, besides supporting the immediate relief, we will continue to focus on addressing the basic needs, such as emergency shelters, protection, health, water, sanitation, hygiene, and psychosocial support. Our latest tranche of medical aids reflect our priorities. This is to help the most vulnerable person, including children and youth, women with infant and young children, the elderly, and the patient with rare diseases and person with disabilities.
A complex and urgent operation indeed. Sahari, thank you very much for that. Sahari Ani, their leader of the Red Cross Singapore mission in Hungary, where he is overseeing medical aid distribution for Ukraine war victims.